In a world where cancer looms as a formidable adversary, a silent accomplice often goes unnoticed: chronic inflammation. Beyond its role as a response to injury or infection, chronic inflammation emerges as a potent driver in the intricate web of cancer development. Join us on a journey as we unravel this enigmatic link, exploring how the persistent fires of inflammation fuel the growth and spread of cancer within the body. Through the latest research and insights, we uncover the hidden connections and empower you with strategies to extinguish this inflammatory inferno, offering hope in the fight against cancer. Inflammation is a fundamental component of the body's immune response, designed to protect against harmful stimuli such as pathogens, toxins, and injuries. However, when inflammation becomes chronic and unresolved, it can create a pro-inflammatory microenvironment that promotes cancer development. Chronic inflammation is characterized by the persistent presence of immune cells, inflammatory cytokines, and reactive oxygen species, ROS, within tissues, all of which can contribute to DNA damage, genomic instability, and tumor growth. One of the key players in the inflammatory microenvironment of cancer is the tumor-associated macrophage, TAM. TAMs are immune cells that infiltrate tumors in response to inflammatory signals and play a dual role in cancer progression. On one hand, TAMs can promote tumor growth by secreting growth factors and cytokines that stimulate angiogenesis, tumor cell proliferation, and metastasis. On the other hand, TAMs can also exhibit anti-tumor activity by phagocytosing tumor cells and presenting antigens to activate an immune response against the tumor. In addition to TAMs, other immune cells such as neutrophils, T cells, and dendritic cells can also contribute to the inflammatory microenvironment of cancer. These immune cells produce inflammatory mediators that can promote tumor growth, invasion, and metastasis. Furthermore, chronic inflammation can induce genetic and epigenetic changes in tumor cells, leading to the activation of oncogenes and the inactivation of tumor suppressor genes, which are hallmark features of cancer development. The relationship between inflammation and cancer is bidirectional, with inflammation both promoting and sustaining cancer development. On one hand, chronic inflammation can create a favorable microenvironment for cancer initiation and progression. On the other hand, cancer cells themselves can perpetuate inflammation by secreting factors that recruit immune cells and stimulate the production of inflammatory mediators. One of the key mechanisms by which inflammation promotes cancer development is through the production of reactive oxygen and nitrogen species, ROS, RNS. These reactive molecules can induce DNA damage and mutations, leading to the initiation of cancer. Inflammatory cytokines such as tumor necrosis factor alpha, TNFA, interleukin-6, IL-6, and interleukin-1 beta, IL-1B, can also promote cancer progression by stimulating cell proliferation, angiogenesis, and metastasis. Moreover, chronic inflammation can suppress the immune response against cancer cells, allowing tumor cells to evade immune surveillance and proliferate unchecked. Inflammation-induced immune suppression can impair the function of cytotoxic T cells and natural killer, NK cells, which are responsible for recognizing and eliminating cancer cells. This immune evasion mechanism enables cancer cells to establish a foothold and metastasize to distant sites in the body. Given the critical role of inflammation in cancer development, targeting inflammatory pathways has emerged as a promising strategy for cancer prevention and treatment. Non-steroidal anti-inflammatory drugs, NSAIDs, such as aspirin and ibuprofen, which inhibit the production of inflammatory prostaglandins, have shown potential in reducing the risk of certain cancers, particularly colorectal cancer. However, long-term use of non-steroidal anti-inflammatory drugs can be associated with side effects such as gastrointestinal bleeding and cardiovascular events, highlighting the need for caution and further research. Another approach to targeting inflammation in cancer is through the use of immunotherapy, which aims to harness the immune system to recognize and attack cancer cells. Immune checkpoint inhibitors such as pembrolizumab and nivolumab have shown remarkable success in treating various cancers by blocking inhibitory pathways that suppress the immune response against tumors. These therapies have revolutionized cancer treatment and offer new hope for patients with advanced or treatment-resistant cancers. Furthermore, lifestyle modifications that reduce chronic inflammation, such as adopting a healthy diet, maintaining a healthy weight, exercising regularly, and managing stress, can also play a role in cancer prevention and treatment. These lifestyle factors can help to modulate inflammatory pathways, support immune function, and create a less favorable environment for cancer development. If you've been experiencing persistent symptoms or something feels different in your body, it's essential to listen to your intuition and consult with your doctor. Early detection is key in cancer treatment, as it increases the likelihood of successful outcomes and treatment options. Regular screenings, self-examinations, and proactive discussions with healthcare providers can help detect cancer at its earliest stages, when treatment is often most effective. Don't hesitate to seek medical attention if you have concerns about your health or notice any changes in your body. Your health and well-being are worth prioritizing, and early intervention can make a significant difference in your journey toward optimal health. In conclusion, chronic inflammation is a key driver in cancer development, fostering a pro-inflammatory environment that fuels tumor growth and spread. Understanding this relationship is crucial for effective cancer prevention and treatment. By targeting inflammation and adopting healthy lifestyle habits, we can improve outcomes for cancer patients. To learn more, click the link in the description. For additional health and wellness insights, visit dreamlies.com and subscribe to our channel for ongoing learning.